Hello, everyone. As most of you know, LASIK is the most popular surgical option if you don't want to be wearing eyeglasses or contact lenses anymore. But did you know that there are other ways to do this if you're not qualified for LASIK? So, good afternoon, everyone. Welcome to another Ask Your Asian Eye Doctor Facebook Live session. I'm Audrey, and this afternoon we'll be discussing the different refractive options that ranges from LASIK, Chance PRK, SupraCor, and even implantable contact lenses, which are commonly known as ICLs. If you have questions, leave a comment at sasagutin namin yan after our discussion. To help us with the discussion today, we've invited multi-awarded doctor, Asian Eyes Cornea and Refractive Service Director, Dr. Robert Ang. Good afternoon, Doc.
Good afternoon. Good afternoon to all the viewers in Facebook Live.
Mhm. Okay, so for those that don't know Dr. Ang, he specializes in cornea and refractive surgery, glaucoma, cataract, and comprehensive ophthalmology. So he underwent the Integrated Arts and Medicine program for his pre-medical degree at the University of the Philippines. He then obtained his rotating internship, medical degree, residency in ophthalmology at the University of the Philippines, Philippine General Hospital. He then pursued fellowship trainings in glaucoma and cornea and refractive surgery at the Harvard Medical School in Massachusetts, in the United States. And aside from authoring several book chapters and international publications, he's also a key resource speaker in local and international conferences. He's an active researcher with interests in refractive options, cataract, and glaucoma. In fact, he was the clinical investigator pioneering treatments such as SupraCor, mixed with iStent, camera corneal inlay, to name a few. He's also multi-awarded, so he's received several Best Paper awards from the American Society of Cataract and Refractive Surgery, as well as the Asia Pacific Academy of Ophthalmology, the Asia Pacific Association of Cataract and Refractive Surgeons, and he's received numerous awards, for example, the Certified Educator Award from APACRS, the Top Gun Instructors Award from the ASCRS, the International Society of Refractive Surgery Presidential Recognition, as well as an award by the American Academy of Ophthalmology. He's also voted as one of the Power List 100 by the Ophthalmologist magazine. So he's the director of Asian Eye's Cornea and Refractive Surgery Fellowship Program, which means that he trains the next generation of ophthalmologists. And he's and Dr. Ang is the Philippines' most experienced and most awarded refractive surgeon. He has done LASIK surgeries for 20 years, starting in 2001, which makes it likely that he has performed more LASIK, PRK, and ICL procedures than anyone in the country. So, Doc, so when it comes to LASIK, when it comes to refractive surgeries, you really spent a lot of time and you have a lot of experience when it comes to different possible scenarios for people that want to get their vision corrected.
So, to the viewers out there, it all starts with your eyes having vision problems or what we call refractive error. So, refractive error in plain Filipino is grado. No? So, if you have
Mhm.
grado, then you go to an optical shop, optometrist, ophthalmologist, and you are prescribed eyeglasses or contact lenses since you're young. So, um, grado comes from number one, genetics or race. The Asian race uh, is predominantly nearsighted. Ibig sabihin, maganda yung near, malabo yung far. Um, and then we also have astigmatism in our eyes, which is kind of a distortion in vision. So the most common refractive error or grade that one will have in the Philippines and in most of Asia will be nearsightedness and astigmatism, or a combination of nearsighted and astigmatism. That's why your glasses are a combination of each. And then we take care of you. So in Asian Eye, we take care of whole families, no? Starting when your children are about school age. So we encourage parents to bring their kids for eye check beginning at age 4 or 5 before they go to preschool, because you want to make sure that they are prescribed the proper glasses to see well during school. And if they are not given the proper glasses before age 7 or age 10, they might develop a condition called lazy eye. So, ayaw nating mangyari yun sa kids. That's why we're happy that some of the schools actually require vision testing every year for the kids. Now, when you reach 18 years old and above and you are wearing glasses or contact lenses, then that's the time you are open to refractive surgery. So refractive surgery means a treatment that we do by an ophthalmologist or a specialist to correct your vision so you don't have to wear glasses and contact lenses anymore. So the range over the past 20 years, technology has grown, improved such a way that refractive surgery now is very safe. The most popular still is LASIK. No? So LASIK means we will cut a flap on the cornea, remove the grade. And the alternative to LASIK is PRK or photorefractive keratectomy, where we don't cut a flap. So laser surgery is two kinds. One is photorefractive keratectomy without a flap, just laser the cornea, correct the grade. Or LASIK surgery means cut a flap, correct the grade, and return the flap to cover the area. The
Okay.
reason, yeah, so the reason why LASIK is more popular than PRK is because the flap promotes faster healing. So no pain, minimal downtime, and you heal very fast. 1 to 2 days, you're back at work, you're back in the office, you're driving.
Mm-hmm.
If you have PRK, it usually takes longer to heal, about 3 days of discomfort and 1 to 2 weeks of fuzziness. But your vision will still improve to 2020. It just was longer. So,
Mm-mm.
but when patients come into the clinic, actually the most important choice for you is number one, do you want refractive surgery or not, for you or for your child, for your brother, for your friend. So
Mm-hmm.
if you want, then you have to go to a refractive center which offers the treatment. In Asian Eye, we have a full range of treatment. We have all the treatments because you may fail one, but you pass the others, or you pass all the options. So you
Okay.
will know on the day of screening because we are here to explain to you the results. So the doctor here is the one, your surgeon, whoever will do your eye, will explain the treatment for you. We don't ask our staff or another doctor to explain. We want to be the one to answer all your questions. We want to be the one to assure you that you're in good hands. So
Okay.
we screen you here in all our clinics.
Okay. And then, Doc, when it comes to the reasons why people get LASIK surgery or PRK, if any of the other options, ano yung mga pinaka-common na reasons that they come to you for? I mean, of course, everyone wants to correct their vision, but what are the other concerns that they bring up to you that push them to really consider LASIK as an alternative?
So right now, this is one of the most common things I heard during this pandemic is that um, before pandemic, everybody was busy, everybody
Mm-hmm.
was traveling, everybody was at work, and now during the pandemic, they got stuck at home. Those who wore contact lenses stopped wearing contact lenses. They wore glasses. And then they found out that it's very inconvenient to wear contact lens or glasses. So convenience or inconvenience is the number one reason why people come. They're sick and tired of wearing glasses.
Mm-hmm.
Second is all these online school, online Zoom, online work makes the grade increase. So we want to treat you, so we lower your grade to a manageable level so that you can manage doing your work or driving or sports without glasses. So inconvenience, and then uh, so that we lower your grade, and then of course looks. No, some people don't like the look of wearing glasses,
Mm-hmm.
and
Mm-hmm.
then
Yes.
medically, some people have contact lens intolerance, so uh, they cannot tolerate contact lens. They've been wearing contact lens for 10 years, 15 years. Now, their eye becomes red, teary, mamuta,
Mm-hmm.
mahapdi. So, wala na, hindi na pwede mag-contact lens yun. Tapos mamaya prone to infection. So, refractive surgery or laser surgery is an option, no?
Mhm.
So all those reasons, one or the other, it falls to them. And then one of the things also that I've heard many patients say is glasses now have become so expensive. I don't know when you went to the optical shop and
Yeah.
then namahalan sila, nagulat sila na mahal na mag-glasses. So
Mm-mm.
binilang nila, 5 years of glasses is probably equal to laser eye surgery. 10 years of glasses is probably equal to ICL or implantable contact lens. So naisip niya, why not just do it and be done with it,
Mhm.
one-time investment, tapos convenience pa. So yan yung mga kwento ng mga pasyente as we see them every day.
I see. So it's really different reasons why people choose to get LASIK surgery done. And I think, Doc, meron rin mga tao, lalo na the ones during the pandemic, na dati hindi nagsasalamin, na kailangan na bigla. So they don't have the habit of really keeping their eyeglasses with them. So all of a sudden, may kailangan silang basahin. They don't remember where they've left it. So it does become like a better option. Sige, magpa-LASIK na lang ako kasi hindi ko naman na-pick up pa yung habit. I might as well get the long-term effect. Gawin ko na ganito, one time na lang, and then enjoyin ko muna yung vision ko for the next 20, 30 years of being glasses free.
Yes, and now kasi the range of age that come to us, dati kasi it's the older patients, no? Yung mga 30 plus years old. Yun yung mga
Mhm.
pumupunta. Tapos ngayon, ang dami ng after high school, 18, 19, 20, who come here because ang tataas na ng grado nila. So there's this
Mhm.
we call it a myopia epidemic worldwide. It's
Mhm.
not just in the Philippines, it's not just in Asia na may epidemic na tumataas yung grado ng mga bata. So yung lahat ng bata ngayon na 10, 20 years na nag-gadget, nag-Nintendo, nagaganyan,
Mhm.
eh,
Mhm.
the side effect in the eye is a longer eyeball. And because of that, they're all wearing glasses or contact lenses. So the younger people now, uh, so this is very common. It's a graduation gift of the parents,
Mhm.
whether
Mhm.
high school graduation or college graduation to their kids. Instead of buying them a gadget, they give them laser surgery.
That's
So
so
marami akong
interesting, Doc.
ganun.
Oo.
Maraming
So para
ganun.
siyang ano, new stage in your life, you get a new look, like a new pair of eyes essentially, yung nagiging dating.
Kasi health, lumaki yung emphasis on health during the pandemic eh.
Mm.
And hindi nila pinapansin yung mata nila dati. And then
Mhm.
ngayon lahat napapansin, no? So,
Mhm.
um, we're just here to help serve them. Pero yan yung mga kwento kaya the LASIK surgeries have grown during the pandemic. More people had LASIK than before the pandemic.
Mm. That's so interesting, Doc. And then siyempre ang madalas rin nating naririnig is, yung LASIK ba pare-pareho lang regardless of where you have it done? Meron bang kaibahan yung machine na ginagamit natin from any other machine that also does LASIK?
So, honestly speaking, syempre, maraming brand ng lasers, just like brand ng kotse. So,
Mhm.
iba-ibang brand yan. So, sa amin, we use Bausch and Lomb laser, which is a German laser, and we're probably the only one in the country right now with a laser like this. And we use it. We use this. I have been using a Bausch and Lomb laser since year 2001. This is our seventh generation of improved laser technology. So imagine mo yung kotse mo, yung cellphone mo, yung iPhone mo, nasa ano ka na, iPhone 13, di ba? So kung
Mm,
nagsimula
mm.
ka sa iPhone 1, alam mo kung gaano kaganda na yung iPhone 12 mo, iPhone 13 mo, or yung Samsung mo na
Mm.
S22 or something. No? So
Oo.
gamay namin yung laser namin. We know how it works. We've been using it and sanay kami, and that's why we can give very, very good and consistent results to our patients. The other
Mhm.
question here, the other thing about uh, where you want to go is we have a very strict screening protocol. No? Kami, pag nag-screen kami, if you want to come and see how we screen you before we say you're qualified for LASIK, you're free to compare it with others. You go to the other places and you're free to compare how strict we are. If no, it's no. If hindi pwede, hindi pwede. If
Mhm.
bagsak ka rito, pasado ka rito, ganun. Mahigpit lang kami and it's for your safety. So
Mhm.
we just want to be strict para we don't have a problem because if your eye has a problem, it is my problem. Diba?
That's
It's
right.
my
Oo,
problem
oo.
too. Hindi namin pinababayaan yung patient after surgery. So first, we screen you very well, making sure that all our doctors and all our equipment are top of the line to screen. Second
Okay.
is our treatment is very controlled and consistent. So 20-year protocol ng ginagamit namin. I've been here 20 years doing this and I have colleagues, 2 to 3 colleagues who do it with me. Next, after surgery care. I'm sure alam niyo yun kasi pag bumili kayo ng kotse, kailangan ng after service care. So, kami nandito, hindi yung tinataguan na namin yung patient o ayaw na namin bumalik yung patient. Kami, pinapabalik namin yung patient for follow-up kahit na 1 month, 3 months, 6 months, yearly. We want to
Mhm.
see you because we are interested in how you're doing. So we want
That's
to
right.
make sure that you're doing okay. I have patients who come back 17 years ago ng LASIK, 19 years ago. Tumanda na kami pareho, and then
Mm.
masaya kung nakikita sila. So, but that's what you want is for us to continue to take care of your eyes kasi hindi lang naman to one-time thing, no? You and your eye will grow old. So, it will change. And
Mm.
we want to make sure that we're here to address all of that, no? So that's one thing I think that makes Asian Eye unique is we treat everybody as a long-term patient. Long-term.
Okay.
Pati
Mm.
families niyo long-term.
Yes, that's something that I have noticed na usually kapag may isang naging pasyente na within the family, they end up bringing their parents or their kids or their siblings because they do see the kind of level of care. Tsaka yung completeness of the screening. Kasi nga, magpapasurgery ka, gusto mong kompleto yung impormasyon na meron ka so that you can make the decision that fits you, that fits your lifestyle, kung anong gusto mong priorities when it comes to your vision.
Tsaka
And then, mm-mm,
isa pa Audrey, no?
mm-mm,
Una-una, hindi namin kayo minamadali magdesisyon na magpa-LASIK.
mm-mm,
So, hindi yung pumunta kayo dito, sasabihin ko, magpa-LASIK ka na mamaya after. Hindi ko ginagawa yon. Kasi
ah,
there are parts of the screening where we need to put eye drops in your eyes to check your retina, no? We need to check everything. And if we do all the tests, no? For example, when we have you have to have a retina check. So the retina is the back of your eye. So we just don't check if you're qualified for LASIK or not. We check you if you have cataract. We check you if you have glaucoma. We check you if you have a retina problem. So all of that is like an executive checkup of your eye if you have a screening here. So
mm,
after the screening, no, first we tell you to go home and think about it. Hindi naman kami namimilit na dito kayo magpagawa sa amin.
mm,
Second is, hindi namin kayo rush to decide today because the lasers have a radar or a tracker. So imagine
mhm.
mo, tumitira yung laser, gumagalaw mata natin eh.
Yes,
So
yes, that's
if
right.
dilated yung mata mo, tapos le-laser kita agad today after your screening, if the laser doesn't lock onto your eye, it can fire in the wrong location. Eh, sinong kawawa? Yung patient. So,
Mhm,
hindi namin ginagawa yung screening and surgery on the same day. You're
mhm,
free to, we schedule you another day, and you're free to choose where you want to go.
mm. So, Doc, I think one of the things that a lot of people have fears about, syempre kapag magpapalasik sila, is that, uy, yun nga, what if gumalaw ako sa surgery? Okay lang ba yun? Baka yun nga, kapag gumalaw ako, ibig sabihin nun mag-laser sa maling lugar. Meaning, parang final destination, yung the fear that they get from the idea na laser yan, baka delikado. So, that's one. As well as yung LASIK ba na ginawa sa akin, pareho lang sa LASIK na ginawa dun sa kasunod ko, pare-pareho lang ba yan when it comes to the surgery? So, what do we do to make sure na those fears are allayed?
Yung gumagalaw, ang kagandahan kasi nga, as I said, 20 years na nag-improve yung technology. So, hindi lang laser namin. I'm almost sure lahat ng laser center sa Pilipinas at sa buong mundo, meron na siyang radar tracker. Kasi nga, noong more than 10 years ago, nung walang radar tracker, nalaman namin na minsan tumitira sa maling lugar. So, hindi okay yun. So, lahat ng laser may tracker as a safety protocol. Now, you just need the tracker to engage. And there is a chance na hindi siya mag-engage if dilated yung pupil. Kaya hindi pwedeng i-dilate yung pupil mo on the same day as your surgery. Eh kung nag-screen ka today at kompleto yung screening mo, ila-dilate yung pupil mo eh. So, maganda na ibang araw na lang. What's another day or two, no? For your safety naman. So, yun yung mga malit na bagay na sinasabi namin na parang konting sacrifice for a good result. No?
That's
so, the
right.
other thing is the, yung, kasi all of us, when we do a job, usually it reflects where we're trained. Eh. So, example, yung Atenista, tsaka yung Lasalista, tsaka yung taga-UP, iba-iba sila mag-isip. Paano iba-iba yung training nila? So, syempre, kami rin mga doktor, may sarili-sariling diskarte. I'm sure tama yung diskarte namin lahat, pero may sarili kaming diskarte na iba-iba. Kasi iba yung nagturo sa iyo eh. So, meron akong sariling technique. I teach my fellows my technique, but other doctors in other places, they had a trainer before or a mentor who taught them. So, yun lang nga, iba-iba yung technique. So, syempre, we cannot comment on other people's technique because kaya nga iba-ibang tao kami. And then it's a matter of experience, track record, ganun. No, kung paano.
Okay, so talagang different strokes for different folks. It really depends on the kind of training you receive at saka the kind of protocols you have in place. Kasi it's really a choice for the doctor as well as for the center kung saan nila pinagawa. Kung ano yung sistema na palagay nila will ensure better visual outcomes. And that's what we're really looking forward to. Pero Doc, kunyari pa isang pasyente gusto niya magpa-LASIK, sino ba talaga yung pwedeng magpa-LASIK? Ano yung mga factors that you consider?
So, the factors are, number one, age. So, when you are age 18 to 40, no, and we do, we call it, in Bosch and Lomb terms, we call it a customized Zyoptics LASIK because that's the brand of laser we have. But you have LASIK or PRK to correct your grade. Now, one good thing about our Bosch and Lomb laser is it has a software for the above 40 years old. So yung 40 to 60 years old, pag pumunta dito sa amin, iba yung software na gagamitin ko kasi mas matanda na sila eh. So kailangan nilang luminaw yung far and meron ding reading. So, iba yung diskarte ng doktor based on age of the patient. Number two, the second most important factor is the amount of grado. So, lasers, I've done laser surgery for starting 50 grade to around almost 1,000 grade. But my experience over the past 10 years tells me that the best results of LASIK and PRK laser surgery is between 50 to 500. If you come here and your grade is 800 or 900, no, chances are I will recommend to you an implantable contact lens and not LASIK. And why is that? Because the more laser you do, yung cornea, yung front part of our eye is the cornea. Binabawasan yung kapal ng cornea based on grado. So kung 100 lang grado mo, konti lang ibabawas ko. Kung 900 grado mo, ang dami kong ibabawas. So mas maraming binawas sa kapal ng cornea mas manipis, mas hihina yung cornea. And as
Mhm.
you grow old, we cannot predict if may long-term effect yung weakening na yun. So, to be safe, no, syempre, we want to leave behind as much cornea as possible. Iba-ibang tao, iba-ibang kapal ng cornea pinanganak. May manipis, may makapal. So, during screening, may calculation software kami dito. So, i-compute ko rin yan para alam mo na agad, pwede ka bang LASIK, hindi ka pwedeng LASIK, pwede kang ICL, malalaman mo. And we explain it to the patient na ito yung recommendation kasi ito yung grado mo, ito yung age mo, ito yung ganon. So, lahat yung factors. Mahirap kasi sabihin na lahat ng tao pasado. Hindi nga
Mhm.
ganun yun eh. Most likely, 70% of patients to 80% will pass LASIK because they will be less than 500 grade. Pero as I said, may 1,500 grade akong ginawa kanina na implantable contact lens, 1,300. So
Mhm.
yung mga ganun, ICL naman sila. So
Mhm.
meron kaming treatment for everybody. So age, grado, corneal thickness, anong request ng patient, di ba? Kasi as I told you, paglampas 40 ka na, meron kaming tinatawag na SupraCor LASIK that has give some reading and retain some amount of distance vision. So yun ang special dito sa Asian Eye. Nakabilang yung may SupraCor LASIK for the above 40. 40 to 60 years old, you come here. If you qualify, we will do it for you. So, yan yung mga meron namin na wala sa iba.
Okay. And then Doc, when it comes to some women naman, syempre minsan they're either pregnant or maybe they're nursing and they wonder, pwede rin ba sila magpa-LASIK?
So, yung mga, actually, being pregnant is a contraindication to any medical procedure. I usually wait till they are by 3 months after giving birth, 2 to 3 months, before screening them. So, I tell them, come back after you give birth, 2 to 3 months, medyo stable ka na, stable na yung baby mo, tapos medyo yung hormonal levels mo bumalik na sa dati, then pwede ka na namin i-screen. So it
Okay.
all starts with screening. So dito sa amin, tatawag ka, we will schedule you for screening. Dito sa amin, matagal ang screening, mga 3 to 4 hours. And yun nga, marami kasing tests.
Mm. And then Doc, bakit mahalaga tong retina check na ginagawa?
Yung mata kasi na nearsighted. So, may taong farsighted, may taong nearsighted. Yung nearsighted, maganda yung near, pangit yung far. Yung
Mhm.
nearsighted, mahaba yung eyeball. So, parang itlog. So, yung mata mo, kala mo bilog yan. Hindi, mahaba yan sa loob. Yung mga nearsighted, yun. Yung mga farsighted, maiksi yung eyeball. So, yung mga taong nearsighted na mahaba yung eyeball na 500, 600 gray, pag mahaba yung eyeball mo, yung inner layer, yung retina, manipis. So, pag manipis yan, pwedeng as you age, may butas na mabutas without you doing anything or numipis and baka mapunit. For example, nagsusports ka,
Mhm.
nag-gym ka, alam mo yun, nagbubuhat ka ng mabigat, or
Mm.
alam mo, yung very common ngayon na may nakita kami is yung rowing machine. Yung rowing machine,
Ah,
you
okay.
squeeze Tapos,
Mm.
nagkaka-retinal detachment sila kasi kakasqueeze sila eh. Imagine mo, repeated, repeated, repeated. Di ba? Eh, yung mga boxingero, narinig mo yung kalaban ni Pacquiao, napunit yung retina, hindi nakalaban. So, yung retina, importanteng i-check yon. Dito sa amin, actually, Asian Eye is a multi-specialty center. We are not just a LASIK center. We are not just a cataract center. We have a multi-specialty from child, retina, glaucoma. So, yung retina doctor ang taga-check kung pwede kang, kung pasado yung retina mo. Tapos
Mhm.
i-clear ka niya sa akin. Sabi niya, oh, cleared, proceed. Or not cleared, may butas. Or prone to
Mhm.
retinal detachment. So, as I said, yung screening is like an executive checkup. So, you get more out of it, more information out of it, whether you proceed or not with treatment.
Okay. And then Doc, syempre one of the main concerns of anyone that undergoes LASIK is, kumusta naman yung recovery? How many days does it take if you want to get LASIK done and you want to have enough time for recovery?
So for our patients who undergo LASIK, since may flap yon, it heals fast. So
Mhm.
if I do your LASIK on a Friday, Saturday checkup, usually Sunday you can drive na, and Monday you're back to work. If you undergo PRK, then mas matagal yon. 3 araw na mahapde and 1 week na malabo. After 1 week, magre-recover ka na. If you
Okay.
undergo ICL, it is exactly like LASIK. If you do your surgery on a Friday, by Sunday you're driving, by Monday you're back to work. So recovery time is over the weekend. So hindi naman ma-hassle ngayon kasi most of the protocols for treatment uh, are geared towards the quickest recovery and the most painless course for you.
Okay.
Whether during surgery, painless, and after surgery, as pain-free or little pain as possible.
Doc, how about TPRK? How is it different from LASIK?
So, yung PRK kasi, photorefractive keratectomy, actually, if you read the history of laser surgery, yung 1998, yung unang-unang beses na may ni-laser yung cornea para sa grado. And
Mhm.
nung ni-laser yung cornea, pag walang flap na ginawa, PRK yun. So yung laser surgery started with photorefractive keratectomy. Nisi-scrape, kinahid nila ng blade, tapos ni-laser nila. Tapos kinorek yung grade. Yun yung 1988. Tapos, noong mga 1993, 94, 95, merong doktor from South America na nag-invento siya nung pang-cut ng flap. So, blade yun, pang-cut ng flap. Doon nanganak na LASIK. So, 1993, 1994. Then, nung year 2001, 2002, 2003, one of the companies invented a laser that will cut the flap instead of a blade. So, doon nanganak yung bladeless LASIK. So, ngayon, lahat dito sa amin, bladeless LASIK. Kaya dalawa yung laser namin. Hindi lang isa, dalawa yung laser namin. Isa pang cut ng flap, isa pang laser ng grado. Ngayon, yung PRK noon is nisi-scrape. Kinakayod,
Mhm.
laser. So, yung latest, the version is yung laser, instead of kakayodin, dire-diretso na lang yung laser. Wala nang kayod-kayod. Yun yung transepithelial PRK. So, yun yung pinakabago ngayon. So, kung magpi-PRK ka lang, no, gagawin namin sa iyo yung walang kayod, transepithelial PRK. Pero kung LASIK ka, LASIK
Mm.
ka. So, kung pasado ka sa LASIK, may hiwa yung flap. Kung bagsak ka sa LASIK, magta-transepithelial PRK ka. Kung bagsak ka sa LASIK at sa PRK, mag-ICL ka, implantable contact lens ka. So,
Mhm.
babagsak ka in one of those. May 1% chance na you do not qualify for all three. Malas mo na talaga no. You're stuck with glasses or contact lens. But
Mhm.
99% of patients that walk into the door will fall into one of those treatment buckets. Or some people qualify for all. And then now you're free to choose which one you want.
I see.
Pero the
Okay.
screening, again, dictates which surgery you qualify for and which surgery you don't qualify.
Mm. So, Doc, when it comes to TPRK, in terms of recovery, is it closer to LASIK or is it closer
Um,
to
it's
PRK?
closer to PRK kasi wala pa rin flap. Ang
Okay.
kagandahan lang is we remove the scraping and the rough handling part. Kaya mas mabilis mag-recover ng konti sa PRK pero hindi na very rough on the patient, no? So
Mhm.
mas pulido na yung PRK ngayon because of that.
Okay.
So transepithelial PRK ang tawag doon.
Mm. And then, Doc, you mentioned kanina yung SupraCor naman. So, if you were to compare it, at least it's for older patients para dun sa mga nagre-reading glasses, para meron rin treatment for them to have reading vision. At the same time, meron din silang distance.
Kasi ganito yun eh. Yung pag lumampas ka ng 40 years old, may taong may grado at may taong walang grado. So may
Okay.
mga taong never wore glasses all their life. Ang saya-saya nila. Tapos nung pumalan silang 42, 43, 45, oh my God, nahirapan na
Oo.
sila sa reading. Galit na
Yes.
sila. Di ba? So pupunta na sila dito. Paano yan? Anong gagawin namin? So meron kaming SupraCor LASIK to make the near better. Pero there is a little amount of sacrifice so far. So we do SupraCor only in the non-dominant eye. Now, the other people above 40 may graduate sila. Ibig sabihin, nagsasalamin sila sa FAR, nagsasalamin din sila
Mm-mm.
sa reading. So,
Mm-mm.
ayusin ko FAR and ayusin ko reading using SupraCor. So, may SupraCor kami for whether you wear glasses for FAR or you don't wear glasses for FAR. This is for some reading power so that you can manage your cell phone, your eating, yung mga
Mhm.
normal daily activities. Kasi
Mm.
hindi namin ini-aim na makita niyo yung gamot, no? Yung sobrang liit na gamot. Hindi na
Oo,
kaya talaga yun kasi tumanda na tayo. Pero at least
oo.
gusto mong pag nag-ring yung cellphone mo o nagte-text ka, kita mo sana yun. Tsaka
Mm.
kumakain. So, normal daily activities like that are very, very useful in everyday living. Everyday living, we want to make your life convenient.
And then Doc, you mentioned kasi na meron naman for those na over 500 in grade, that there's such a thing as yung implantable contact lenses. So, you said the recovery is also quite quick as compared to LASIK. Pero paano siyang naiiba, Doc? Ano ba yung naging procedure for this?
So, yung ICL kasi, actually, this ICL was invented about 30 years ago in the US. So, it's a soft contact lens na nilalagay sa loob ng mata. So, may patients who are done 30 years ago. Ako naman, I started my ICL journey mga 11 years ago. So, ito yung ICL. It's a rectangular shaped contact lens that you put inside the eye without removing anything. Walang tatanggalin sa mata mo, ilalagay mo lang yung contact lens sa loob. This is different from lens extraction or lens exchange or cataract surgery where your natural lens is removed and is replaced by a lens implant. Ito, we don't remove your natural lens. We just put this contact lens inside your eye. This is a 10-minute procedure per eye. You are asleep. When we do this, we let you put you to sleep. But this lens has to be ordered from a company in California. So
Mhm. Mhm.
we screen you, and then if you qualify for this, and if you want to proceed, we will order one that is a custom-made lens for you.
Okay.
Now, this technology is used to be only for those who did not qualify for LASIK or PRK. Yung bagsak ka talaga,
Mhm.
wala na, ito na.
Mm.
Pero recently kasi na-realize namin na the ICL's quality of vision is actually sharper than LASIK. Mas malinaw pa siya sa LASIK. So, yung mga ICL patients ko, paglampas 500 na, inaalok ko na siya ng ICL. Pero may mga tao na 200, 300 na grade. Gusto din nila mag-ICL kasi gusto nilang malinaw. Lalo na yung mga magpapiloto, yung mga
Oo.
magpa-pilot school, yan ang request sa amin. Kasi they need to land the plane at night, di ba? So, nighttime vision is actually compromised with LASIK and PRK, especially high grade. So pag mataas na grado mo at LASIK kita PRK ka, sometimes yung gabi is not as sharp. Kita mo nakaka-drive ka, but may glare, may halo, hindi sharp yung contrast. So the
Mhm.
ICL will not sacrifice contrast. It's as good as an untouched eye. Nilagay lang natin yung ICL. So quality of vision, superior to LASIK and PRK. Grade, you can start from 100 all the way to 1,800 grade.
Wow,
Age,
okay.
you can start from 18 years old to 60 years old. So it covers even LASIK. The only thing naman that's a problem here is this is more expensive than LASIK or else everybody
Yes.
would do this. So,
Mm.
pero syempre yung mga iba, gusto pa rin LASIK kasi your friends have had it, your relatives have had it, maybe your mom has had it, and then you
Mhm.
will have LASIK. So,
Okay.
meron kami lahat.
Mm. So Doc, kasi sinabi mo diba, it's implanted, right? So may dinadagdag sa loob ng mata. Is there ever any sort of fear, ay, may pinasok na may dinagdag. Does that mean posible siyang ma-reject ng katawan?
Ang kagandahan nito, the material is such that that's why only one company in the world makes this because they have the patent for this material called Collamer. So actually, yung
Mhm.
ICL, yung eye implantable. Yung C, Collamer yun eh. Tawag lang namin implantable contact lens, but the scientific name of this is implantable Collamer lens. Collamer is a special material made of collagen, and you know collagen is part of the body. So it's biocompatible. It can be left in your eye. There are people who have ICL 30 years already in abroad, no? Because they started ICL way before me. So it can remain inside the eye that long without causing any rejection.
Okay.
So, pwede. Kaya yung mga nilalagyan kong bata ngayon na 19 years old, eh pagdating nila ng 50 years old, nandiyan pa rin yung ICL nila.
So, Doc, ganun. Kasi syempre, dinagdag siya, no? It was just implanted. So, for whatever reason, pwede rin siyang matanggal?
Hindi siya tinatanggal. So, the ICL, so all of us will grow old. So there are questions in the chat box kasi I see them and how long does LASIK last? How long does implantable contact lens last? So first of all, everybody will age. So whether we touch your eye or not, your grade will increase. But we have noticed that patients who were treated with LASIK, with PRK, with ICL, wherever, since na-treat ka, somehow the increase in grade was not so much compared to somebody who did not have treatment. So we just noticed that. So, so pag ginawa ko yung grado mo at bumaba ka to 0 grade or 25 grade, usually it will last you at least 10 to 15 years. At least with my Bosch and Lomb laser, it's like that. Then, if you had LASIK 15 years ago and nagbago na yung grade, option 1, we can screen you again to find out if we can laser you again. If your cornea is thicker, pwede ka pang i-LASIK. No? And tumanda ka kaya nag-change yung grado mo, or talagang buong araw ka, 10 hours, 12 hours a day ka sa computer, talagang tataas grado mo. That's why we advise people to rest. Every 3 hours to 4 hours, you rest your eye. Kasi too much activity, parang muscle yan eh, too much activity, malalaspag yung muscle mo eh, di ba? Yung gym ka, ganun din yung mata natin. So, pwede kang i-LASIK ulit, kung pwede pa. If may ICL ka, pwede kang umorder ng bagong ICL at palitan natin yung ICL mo. Pag na-PRK ka, pwede ka uling i-PRK basta makapal pa yung cornea. So, the main factor is, do you have enough corneal thickness for a touch-up LASIK or PRK or what we call enhancement? So, your doctor, your clinic should have the equipment to check. Kasi meron kami ng equipment to check kung makapal pa yung cornea mo o wala. So, kailangan i-check. Tapos, pwede mong pagawa yun. Kasi, ano naman yun eh, acceptable naman yun na nagamit mo na matagal. Siyempre, tumanda ka na rin, di ba?
And then, Doc, posible naman ba na maging combination siya? So, let's say I had LASIK done 5 years ago, and then another 15 years, parang maisip ko, alam mo, parang nagka-change na in my vision. Pwede ba akong magpa-ICL at that time?
Meron na akong mga patient na ginawang ganyan. No? So, some of them had LASIK or PRK elsewhere, 20 years ago, even here, and tumanda na sila. So, 44, 45 na sila, gusto nilang mag-drive na walang salamin, no? Okay lang sa kanila mag-reading glass, pero gusto nila mag-drive, 250 grade nila, 300 grade nila. So, nung chinek ko yung cornea nila, manipis na. So, kung manipis na, hindi na pwede mag-LASIK. So, sabi ko sa kanila, may ICL dyan, pwede naman. So, if you had previous LASIK or PRK, if you qualify for ICL, you can have ICL later. Now, if you had ICL to begin with, I suggest you change your ICL instead of going for LASIK after ICL. It's better to change your ICL to a newer model. And let me explain ICL. You see this ICL, the blue lens? Do you see the hole in the middle? Yung modern, latest version ng ICL, which we have been using the past 6-7 years, has this hole, and this hole allows fluid to flow. Kaya, the previous, if you go to scientific publications, blogs, online chatter about complaints about ICL, it was the older model without the hole. And because there's no hole, it was touching the lens, causing cataract. So there was like a 8% incidence of cataract after 5 to 10 years in the older model, and some percentage of glaucoma. But this new one with the hole is has virtually almost eliminated to less than 1% the incidence of cataract and glaucoma long term. That's why we've been using the hole, the lens, the ICL with the hole. Kasi tinanong ako ng patient ko, ano kaibahan nito sa dating version? Ba't may mga report
Mm-mm.
na ganun? Kasi if you read those journals, totoo yun na yung mga lumang model na merong ganyang incidents. Kaya may mga patient din ako na merong walang hole. Binabantayan ko sila every year. That's why it's very important that wherever you choose na clinic, you are welcome to go back there every year para i-check,
Mhm.
magpa-check up kayo. Kasi ako, nandito pa ako, 20 years na. So, yung doctor mo, papa-check up ka sa kanya every year. Parang long-term
Mm.
relationship yan with your doctor.
Okay. And that makes sense though kasi syempre hindi porket nagpa-surgery ka once, okay na, nothing ever to worry about. It's still important that you check your vision yearly para ma-monitor kung posible namang hindi sagrado yung naging problema. It could be that there are age-related changes or merong ginawa sa lifestyle mo that could be affecting your vision.
Mm.
So, Doc, kapag, sige, meron tayong patient dito, maybe one of our viewers here today is kind of thinking, alam mo, gusto mo magpa-LASIK. Ano ba yung kailangan kong paghandaan kung gusto ko magpa-screening?
So, una-una, if you are a contact lens wearer,
Mhm.
1 week, soft contact lens, 1 week ka magpahinga, magsalamin ka lang. If you
Mhm.
are an RGP or rigid Gasper, hard contact lens wearer, mga 3 weeks ka dapat magpahinga.
Mhm.
Kasi yung long-term contact lens wear causes several things. Number one, dry eye. Maraming may dry eye dahil sa contact lens. Number two, yung cornea mo na-deform siya. So, hindi yan yung original shape ng cornea mo at hindi yan yung original grado mo. Pag tinanggal mo yung contact lens mo, pinahinga mo, lalabas yung tunay na shape ng cornea, lalabas yung tunay na grado mo. And what we want to treat is your true grade, not your artificial grade because of the contact lens. So,
Hmm.
yun lang ang hinihingi namin. Walang ibang preparasyon except magsalamin ka lang for at least a week to 3 weeks. Depende kung anong klaseng contact lens. Tapos you just come here and have
Mhm.
yourself screened. Ganun lang. Yun
Pero
pa, wala na
oo,
ibang...
oo. Concern ba, Doc, let's say napuyat yung patient, is that an issue kung magpapa-LASIK screening ako
Hindi
the next
naman.
day?
Hindi naman po problema yung puyat. Nakikita,
Mhm.
kung may dryness ka, meron kaming madidetect ng machine namin yon. We can put some drops during your screening. Pag puyat ka, hindi nakaka-affect yung puyat. Maybe pagod ka na wala ka sa condition to have the screening, pero
Mm.
it doesn't affect our measurements, no? Another thing is, may mga patients sabi sa akin na taon-taon daw nagbabago yung grado nila, di ba?
Mm.
Last
Mm.
year,
Mm.
2 years ago, nagbago salamin. So, pagdating dito, we check the cornea, we check your grade, we check your history, we check the corneal curvature. If we think that you should wait longer, we can tell you to wait longer. Pero most of the time, we can confirm naman na you're more or less stable. And as I said, one of the benefits of LASIK or whatever treatment is, yung pag-increase mo, mababagalan yan by the treatment.
Okay.
So, makakatulong sa iyo yun.
Mm. And then, Doc, dahil binanggit mo na siyempre dilated yung patient kapag nagpa-screening, ibig sabihin nun, mas okay na huwag ka mag-drive. Kung
Oo,
pupunta
hindi
ka
sila
for
pwede
screening,
mag-drive.
huwag ka mag-drive.
Mag-uwi sila, mag-ibang driver sila, mag-Uber
Mm.
sila, mag-taxi na sila kasi nga
Mhm.
mahirap mag-drive after for a few hours, no? For a few
Okay.
hours.
So, Doc, yung epekto ba ng dilation, matagal ba yon? Does that mean the next day, medyo mahirap pa sila mag-function?
Minsan kasi, yung effect ng drops ng dilation can last mga 48 hours. So may mga patient tawag sa amin, medyo nahirapan pa ako mag-focus kasi dahil sa effect ng drops. But you just wait because the effect will go away on its own.
Mhm.
Most people, 4 to 6 hours. So, pag uwi nila, next day, they're okay. Pero some people, kung matagal, you can come back, we can put reverse drops. We generally don't put any reverse drops because it goes back. But there's no long-lasting side effect of the dilation, no?
Okay.
So, okay mag-alala doon. Tapos, may isa
Mhm.
dito question of a blood thinner. walang problem about blood thinners or something. Wala rin problem kung diabetic ka, we will check you. Kung high blood ka, we will check you. So, yung mga, kailangan lang namin malaman yung history mo. Yung ba, may goiter ako, may thyroid problem ako. Sabihin mo lang sa amin. Kasi screen ka naman namin eh. Pero maraming tao may diabetes, maraming tao may high blood. So, pero it doesn't mean that we cannot make your vision better. No, we can. Maraming choice. Maraming choice.
And then, Doc, isa rin common question is, meron ba tayong LASIK warranty? Ano ba to? Meron bang inclusions for this?
Yung mahirap kasi sa warranty is, it presupposes that you will not change it. You will not change as you age. Wala namang biology na gano'n. Kaya nga yung Botox, every 3 months ka nagbo-Botox kasi mabalik yung wrinkle mo. Pero, when you have LASIK with us or PRK and you're qualified, when we do your touch-up, usually we just charge you a minimal laser fee. I don't charge my professional fee if you have a touch-up, even 10 years later. It's just that the hospital has a cost to activate the laser and supplies eh. So, may bayad yun. Pero hindi yun kasing mahal nung original na treatment.
surgery.
Oo.
And then, Doc, syempre after surgery naman, ano yung mga considerations for patients? Ano ba yung pwede tsaka hindi nila pwedeng gawin?
So, yung LASIK, PRK, ICL, after surgery, there's a general set of precautions. The main complication that we want to avoid is infection. So, the worst kind of problem after any surgery is an infection. So, first, we will give you goggles, which you should wear for at least a few days to a week. We will give you eye drops, which you should use at least for 2 weeks or longer. Then we tell you not to wet or rub your eye for at least 1 to 2 weeks. Not to do exercise or sports for maybe 1 to 2 weeks also, or no eyeliner, no eye makeup, and no swimming for a month. All of these are for you to avoid any foreign body going inside your eye that might cause an infection. But you can do your email, work the next day, watch TV. Using the eye is not part of the contraindication. Food is not part of the contraindication. So you can eat anything, wala naman ganun. Pero yung ingat lang na walang pumasok sa mata, that will cause an infection.
Okay. At saka, Doc, yung wag magbuhat ng mabigat. Also, it's a consideration.
Usually, yung mga ICL or yung mga cataract surgery, we tell you not to do that as a set of precautions din. Sports din, alam mo, lalo yung mga basketball, is ka muna for mga 2 weeks, 1 to 2 weeks. Ganyan.
And then, Doc, syempre, a lot of people are also still worried kasi may pandemic pa rin naman. Is it safe to do refractive surgery? What are we doing to make sure na safe maging experience ng pasyente?
So, when you come to Asian Eye, you will see that we have been continuing our COVID protocols. No, look at me, I'm in PPE. This is our PPE. We still wear it. Our whole facility, we get tested regularly. Our staff, all patients for surgery will need to get a PCR or an antigen, and then our rooms are sanitized, and our LASIK room and our operating room. Actually, ever since 20 years ago, we have already installed this special laminar airflow HEPA filter in our operating rooms, even when there was no COVID. Kaya nga our operating rooms and laser rooms were one of the cleanest in the country. Wala kaming split type aircon dyan na nakikita mo na nakadikit sa pader, tapos papunta sa mukha mo while you're having surgery. Walang ganun. Kasi nga, we follow the guidelines of the architect that designed Asian Eye from the US and said that, this is what we use there. Mag-invest kayo, i-pipe in lahat ng air. So yun ang ginawa namin. So 20 years ago, we were COVID ready already. So yung airflow sa loob ng operating rooms namin are pretty clean. It benefits not only you, benefits us, the staff. Kami kasi yung mahahawa sa inyo kung COVID positive kayo. So ingat din kami. for that.
So that's good to hear kasi syempre, the last thing you want is to come in for an eye problem and then all of a sudden you're scared. Makakadagdag pa yun sa anxiety of undergoing any kind of procedure.
Yes.
Mm. And then, Doc, here, we actually have quite a number of questions from our chat box.
Yes.
So the first from Sharon is, I underwent LASIK surgery back in 2016 for my myopia, but it came back in 2019 and I've been wearing glasses again ever since. Can I still undergo LASIK surgery to correct my myopia again?
Yes. Screening to see if there's enough corneal thickness. Now, one of the things that another thing we notice is for women who get pregnant after
Mhm.
LASIK, maybe 20 to 30% of them seem to grow back or regress some of the nearsightedness na we corrected. And
Mhm.
it's probably related to the hormonal levels. So, if that happens, we tell you, okay, uh, tapusin mo muna yung childbearing years mo, manganak ka lang
Mhm.
ng manganak, pagkatapos doon, tsaka ka bumalik sa amin at tsaka natin ayusin. Kasi sayang
Mm.
naman. So,
Yes, kasi every time magbabago na naman.
yeah, so tapusin mo muna yun. But if you're over and done, factory is closed, then I can fix your eye na. No?
Okay.
Diba?
Ito naman, Doc, sabi ni Rochelle, I have high grade with astigmatism po and or I already have one bad eye. May I know what is the best treatment para magkaroon po ako ng 20/20 vision?
The all the procedures are designed to give you 20/20 vision. But what you
Mm.
qualify in nga is based on the screening. So kung mataas grado mo, malamang ICL yung pinaka best shot mo, no?
Mm. And then
So,
ito, Doc, kasi, so it's not just about nearsightedness or
oo.
farsightedness.
Hindi ko kasi
It's near
maintindihan kung ano ibig sabihin ng bad
astigmatism.
eye eh. Di ba mali
Mm-mm.
mo may disease pala yan na hindi pwede.
Ah,
You might have something na we really cannot treat you. Pwede kasing merong ganun ka and we will not push the treatment if hindi pwede.
mhm. Okay. Ito naman, Doc, from Miss Beth. Yung cataract po, pwede bang i-LASIK o i-laser?
If you are above 60 years old, chances are you have cataract and we don't LASIK, PRK or ICLU anymore. When you have cataract and you come here, we have two types of cataract surgery. One is the regular style called conventional surgery wherein we use a blade and we use an ultrasound vacuum called phacoemulsification. We also have a laser to make the incisions or the cuts during cataract surgery. So we have a laser-assisted cataract surgery. So meron
Mhm.
kaming laser cataract surgery dito, na tunay na laser cataract surgery. Hindi yung kunyari, kasi may ibang doktor, kino-quote nila yung ultrasound as laser. Hindi totoo yun.
Mm.
Meron kaming talagang laser for that here. Pero
Okay.
i-explain namin sa'yo. Kasi pipili naman yung patient dito eh. Gusto nilang yung conventional o gusto nilang yung laser. Meron kami
Mm.
pareho.
Okay. And then ito naman, Doc, from Angeli. What is better for correcting your vision? Yung implantable contact lens or yung magpa-LASIK surgery?
ICL gives the clearest, sharpest vision because
Mhm.
it does not alter anything in your optics. So, siya talaga yung top of the line now. Pero if you qualify for it or just LASIK, yun sa screening namin masasabi.
Okay. And then from RC Lazaro, is it true na 10 years maglast ang LASIK and then I will need to redo the surgery after 10 years?
Our laser, our Bosch and Lomb laser that's been here for 20 years, our statistics show that only about 2 to 3% of our patients want come back for touch up.
Mhm.
So about 95% to 97% still have good enough vision. I'm not saying they don't change because everybody changes. Pero hindi
Mhm.
na bumalik yung 200, 300 na grado nila. Maybe bumalik 75,
Oo.
100, which is still manageable eh. Kung nanggaling ka
Oo.
sa 600, tapos nagkaroon ka ng 75 after 15
Parang,
years,
oo.
sulit na yun, di ba?
Yes, yes.
Napakinabangan mo na yun. Pero
And
yun,
ano, and Doc, kasi we do have to understand that after that many years, there are changes na talagang dala na lang sa pagtatanda din.
pero hindi totoo yung sinasabi na 10 years lang maglalast. Hindi.
Mm.
Pero depende yan sa laser na brand na ginamit sa'yo, yung technique ng doktor, tsaka yung aging mo. So, halo-halo, hindi mo na ma-identify which one eh.
Mhm.
So,
Mhm.
halo-halo na yung factors.
Okay. And then okay, if you were to compare daw PRK versus LASIK, ano naman yung mas okay na aside from healing time? Ano yung mas maganda in terms of long-term effect and safety for the eyes?
So, yung LASIK kasi, everybody wants LASIK because there's no pain. Honestly, yung PRK, mahapdi siya talaga for the first 3 days. So, maraming patient na nahahapdian at nagko-complain. In terms of long-term side effect, pag wala kang flap sa LASIK, so pag PRK ka, mas matibay yung mata mo kasi wala kang flap eh. Mas matibay yung mata mo. So long-term strength, you have a stronger eye after PRK. Pero the result of visual accuracy, outcome, accuracy of treatment, LASIK is a little bit ahead. So
Okay.
may plus, may minus.
Okay. And then ito naman, Doc, pwede po bang magpa-walk-in or do I need to be referred by a doctor to get an appointment?
You can come to any of our Asian eye clinics. Marami kami. May sa Trinoma, may sa Mall of Asia, may sa Alabang, mayroong Rockwell. Siyempre sa Rockwell yung pinaka-complete, no? So, you can call or you can... Mas maganda mag-call kasi not every day is screening here. I'm not here every day. Some of the doctors are not here every day. So, may day, tsaka may time na
Yes.
pupunta ka. Basta set aside 3 to 4 hours.
So you really just need to call or send us a message and we'll try to set your appointment for you.
Yes.
And then naman from Yolanda, is it okay to travel via plane after LASIK operation?
Usually 2 weeks after, we let you travel.
And then ito naman, I'm an OFW and I'm planning to get LASIK when I get back to the Philippines. How many days should I allot, if ever?
So, if you are before you come home, kung naka-contact lens ka, magsalamin ka na lang. Para pagdating mo, the next day, we can screen you. And then the day after or 2 days after, we can do your LASIK. So, in the next 3 to 4 days, na pagdating mo sa Philippines, gawin na natin yung LASIK mo para during healing, tsaka ka umuwi sa inyo, magbakasyon, tsaka mo gawin yun para habang nag-heal ka for the next 7 days to 10 days, gumagaling ka. So, nandito ka mga 2 weeks siguro, kasya na yun.
Okay. And then ito naman, Doc, sabi na glaucoma suspect ako. Can I still undergo LASIK or any refractive procedure?
So, we see many. So, long eyeballs, pag mahaba ang eyeball mo, may certain percentage of patients na yung optic nerve mo suspicious and mukhang glaucoma. So, tawag doon glaucoma suspect kasi hindi ka glaucoma, pero hindi ka normal.
Okay.
So, we do a glaucoma screening aside from a LASIK screening. So, pupunta ka rito, screen ka namin sa LASIK. Pag nakita namin na delikado o alanganin yung optic nerve mo, we will also screen you for glaucoma. If the test results of that glaucoma screening are normal, you can have LASIK or PRK. If it's abnormal, bagsak ka. So you have to undergo both those screenings. Meron kami, kumpleto nga yung lahat ng clinic namin for that.
Ito naman, Doc, interesting question from Donna. I'm taking hormonal pills. Do I need to stop that before the eye screening and LASIK surgery?
No, we don't ask you to stop pills, vitamins, and all that because that's part of your health. No, usually it doesn't affect it except for dryness or something like that. It doesn't affect the healing of the surgery. So we will let you continue that. We just need to note that in your history when you come.
And then another question naman from Nicolo. Pwede po ba magpa-LASIK kung 1,010 at 1,000 yung grado?
ICL yung solusyon sa iyo, Nicolo. Kasi yun ang safest and best solution for very high grade.
Okay. And then, is it okay to undergo LASIK pag may eye ulcer?
Ang eye ulcer is an infection. So, ulcer means infection usually coming from contact lens wear. So, everybody listening, if you're wearing contact lens, please do not sleep with the contact lens on. Yan yung number one source of infection sa corneal ulcer sa mata because tinulog mo yung contact lens mo or hindi mo nilinis. No? Linisin nyo yung contact
Mm.
lens nyo. So, pag nagka-ulcer na yung cornea mo at nag-heal yun, magkakaroon ng scar o peklat. Hindi ka na pwedeng i-LASIK o i-PRK. Ang ginagawa ko sa mga ganyan, ICL. So may chance na luminaw mata mo. Kasi usually nagka-ulcer, 600 grade yan, naka-contact lens siya, tinutulog niya, o paano yan? May 600 grade pa rin siya, di ba?
Mm.
ICL ang ginagawa namin.
Okay. Ito naman, Doc. Pwede ba ang LASIK for people with lazy eyes?
Lazy eye means that your vision did not develop 100%. So pwedeng 50% ng vision mo, 70%. If we do LASIK on you, you will achieve 50 to 70%, but without glasses na. But it will not go back to normal na nawala yung lazy eye. Lazy eye is a condition forever.
Okay. And then, Doc, so actually that was a lot of questions from our viewers today. Do you have any additional advice for the ones that are watching us today who are still thinking about getting LASIK done?
LASIK, refractive surgery has become very safe, very effective with very good results. So there are many places offering refractive surgery. Ang kaibahan lang sa amin, we have all the options are here. So if dito ka pasado, ito gagawin namin. Pag dito pasado, ito gagawin namin. Hindi ka namin pipilitin kahit alanganin ka sa one procedure or the other. We have the strictest screening protocol. We have a complete we have to complete a line of specialties here. So kung ano man ang problema ng mata mo, we can deal with it and make sure that it's safe for you to have laser surgery. And lastly, we take care of you in the long term. So, kung pasyente ka na namin habang buhay. So, that's what we do in Asian Eye is we establish a relationship with you and your family.
Okay. So thank you, Doc. I think that's very useful and also gives patients peace of mind. Because it's not a one-time thing. We're here for you for the rest of your life and when it comes to your different vision needs. And uh, and then for those patients naman, Doc, who want to get screened by you or they just want to get a checkup, where can they find you?
I think first, maybe you want to call our email. We're on Facebook, email, call 8898-2020, call 0918-898-2020. Pare-pareho lang yung number namin. You see it on the screen. Take a screenshot of this. May teleconsult line kami, although it's better to come. Meron kaming iHealth at asianeyeinstitute.com or you can search us in the internet, no? asianeyeinstitute.com and you will see and you can get in touch with us there. And you can just send us a message asking for an appointment. And then we will give you an appointment day and time that's convenient for you.
Okay. And then, Doc, actually, meron pang humaba na isang question. Kapag nagkaroon ng cataract later or maybe a few years after LASIK or PRK, pwede po ba magpa-surgery pa din for cataract?
Okay. Cataract is an old age disease. Everybody, all of us will have cataract when we reach 60 years old and above. Whether you had LASIK, PRK, or ICL before, or none of the above, you will have cataract. So, ang kagandahan kasi is we can safely perform cataract surgery whether you had previous LASIK, PRK, or ICL. The tricky part is cataract surgery means you remove the cataract and place a new implant inside your eye. So, yung doktor nyo dapat marunong siya mag-calculate ng grado ng lens na implant na ilalagay sa mata nyo dahil na LASIK, na PRK, or na ICL kayo dati. So, yun lang ang requirement. Dapat marunong yung doktor nyo mag-calculate nun and you'll be fine. Pero pwedeng mag-cataract surgery ng mga ginawang refractive surgery before.
Okay. And then, so for the ones watching us today, kapag gusto niyo magpa-schedule with Dr. Ang, you can find him in our Rockwell Clinic on Mondays, Thursdays, and Saturdays, and then Trinoma on Wednesdays. So once again, Doc, thank you for spending your afternoon with us. We learned a lot. It was a very informative discussion.
Thank you so much for listening. Until next time.
Thank you, Doc. And then for those who are interested to book naman for LASIK or refractive screening, we have a couple of ongoing promos. So first, there's 30% off when you undergo LASIK surgery within 7 days of your screening, about 20% off if within 14 days of your screening, and 10% off if within 30 days. So there's just a couple of options for you so that you can maximize what you can and what you're able to schedule when you want to get your LASIK done. We also have 15% off on LASIK screening surgery if you use a Pag-ibig loyalty card. And we have 0% installment for up to 6 months for BPI, BDO, RCBC, and PNB credit cards, and 0% interest up to 12 months for Security Bank credit card holders. If you or a friend or a loved one want to get LASIK screening done, you can get a LASIK Buddy e-gift certificate, which allows you to have 2 LASIK screenings for only 3,900. You can get the EGC via asianeyeshop.com. For your eye care and eyewear needs, please visit asianeyeshop.com. You can get a free upgrade to screen shield lenses for daily specs and kid specs frames. And then, kunyari, you're still going to the beach, you still have plans to go traveling. There's buy one, take one on active specs sunglasses. And there is also free shipping nationwide for purchases of 1,700 pesos and up. So that covers different eye care products, including the eye drops that you might need, some contact lenses or glasses or sunglasses. So again, if you have any other eye concerns, you may call the Asian Eye hotlines that are flashed on the screen. We hope you were able to learn a lot today, and we'll see you on our next Facebook Live session. Continue to stay safe, everyone, and we'll see you again.